The pursuit of better health is a universal human endeavor. Around the world, countries strive to improve the well-being of their citizens, tackling diseases, strengthening health systems, and promoting healthy lives. While the challenges are many and the context diverse, a close examination of success stories reveals common threads that weave a tapestry of hope and inspiration. By understanding these shared factors, we can chart a course toward a healthier future for all. In an interconnected world, the lessons learned from one corner of the globe can illuminate the path for others. This essay delves into the remarkable achievements in global health, focusing on the common denominators that underpin success. From the bustling cities of the Dominican Republic to the rural heartlands of Senegal, we will uncover the key drivers of positive change and explore how these insights can be adapted to different contexts. Our journey takes us beyond statistics and reports, into the heart of communities where progress is not just measured in numbers, but in the lives saved, the suffering alleviated, and the hope restored. Through vivid examples and compelling narratives, we will witness the transformative power of political commitment, community engagement, data-driven decision-making, and other crucial factors. This is not just a story of distant successes, but a call to action for all nations to learn, adapt, and collaborate in the pursuit of a healthier, more equitable world. By embracing the lessons learned from exemplars in global health, we can unlock the potential for a brighter future where every individual has the opportunity to thrive. While each nation's journey is unique, research consistently identifies several crucial factors driving success in global health. These 8 pillars, often interconnected and mutually reinforcing, provide a framework for understanding how countries make significant strides in improving population health. 1. Political commitment. Strong leadership, often from the highest levels of government, is essential. This commitment translates into sustained funding, supportive policies, and a clear vision for health as a national priority. 2. Community engagement. Successful health interventions are deeply rooted in the communities they serve. Understanding local needs, cultural contexts, and traditional practices is crucial for designing effective and sustainable programs. 3. Data-driven decisions. Robust health information systems are vital for tracking progress, identifying challenges, and making informed decisions. The ability to collect, analyze, and utilize data effectively allows for targeted interventions and efficient resource allocation. 4. Access to quality healthcare. Ensuring equitable access to affordable, quality healthcare services is paramount. This includes investing in infrastructure, training healthcare workers, and addressing disparities in access based on geography, socioeconomic status, or other factors. 5. Health education and promotion. Empowering individuals and communities with knowledge about health and disease prevention is crucial for long-term impact. Effective health education campaigns can promote healthy behaviors, encourage early detection, and reduce the burden of preventable diseases. 6. Public-private partnerships. Collaboration between governments, civil society organizations, and the private sector can leverage resources, expertise, and innovation. These partnerships are often essential for expanding access to healthcare, developing new technologies, and addressing complex health challenges. 7. Social determinants of health. Addressing the broader social, economic, and environmental factors that influence health is crucial for achieving sustainable improvements. This includes tackling poverty, improving education, and ensuring access to clean water and sanitation. 8. Adaptability and innovation. The global health landscape is constantly evolving. Successful health systems are adaptable, innovative, and responsive to emerging challenges and new scientific discoveries. This includes embracing new technologies, adapting strategies based on lessons learned, and fostering a culture of continuous improvement. Senegal stands as a testament to the power of political will and community engagement in driving remarkable improvements in maternal and child health. Despite facing significant resource constraints, Senegal has made significant strides in reducing child mortality and improving maternal health outcomes. One of the key factors behind Senegal's success is the Bamako Initiative, a community-based approach to healthcare launched in 1987. This initiative empowers communities to manage their own health services, with local committees responsible for financing, drug supply, and community health worker supervision. This bottom-up approach has been instrumental in expanding access to essential healthcare services, particularly in rural areas. Senegal has also demonstrated a strong commitment to political leadership in healthcare. The government has consistently prioritized maternal and child health, allocating increased resources to these areas and implementing policies aimed at reducing financial barriers to care. This commitment is evident in the country's performance on key indicators, with under-5 mortality rates declining significantly in recent decades. Furthermore, Senegal's success highlights the importance of integrating vertical programs, such as those focused on specific diseases, into the broader health system. By strengthening the overall health system and empowering communities, Senegal has created a more resilient and responsive healthcare infrastructure capable of delivering a wide range of services. Emerging from a devastating civil war and grappling with the Ebola epidemic, Liberia's journey showcases the resilience of the human spirit and the power of international collaboration in rebuilding shattered health systems. The country's experience offers valuable lessons in strengthening health infrastructure, training healthcare workers, and establishing effective disease surveillance and response mechanisms. In the aftermath of the Ebola outbreak, Liberia, with support from international partners, undertook a comprehensive overhaul of its healthcare system. This included strengthening disease surveillance and response capacities, establishing new treatment centers, and training healthcare workers on infection prevention and control measures. Recognizing the critical importance of a well-trained healthcare workforce, Liberia has invested heavily in training and capacity building for doctors, nurses, and community health workers. This investment has been essential in improving the quality of care and ensuring the sustainability of health interventions. Liberia's experience underscores the importance of community engagement in building trust and ensuring the effectiveness of health interventions. During the Ebola outbreak, community health workers played a crucial role in educating communities about the disease, promoting safe practices, and encouraging people to seek timely medical care. Section 5. Dominican Republic, tackling non-communicable diseases. While many developing countries face a double burden of communicable and non-communicable diseases, the Dominican Republic has taken proactive steps to address the growing threat of non-communicable diseases like heart disease, cancer, and diabetes. The country's experience provides insights into developing effective strategies for prevention, early detection, and management of these diseases in resource-constrained settings. The Dominican Republic has implemented a multi-pronged approach to tackling non-communicable diseases, focusing on raising public awareness about risk factors, promoting healthy lifestyles, and strengthening healthcare services for early detection and management. This includes public awareness campaigns, community-based health programs, and initiatives to improve access to affordable medications and care. Recognizing the importance of data in informing policy decisions, the Dominican Republic has invested in strengthening its health information systems to better track non-communicable disease prevalence, risk factors, and treatment outcomes. This data-driven approach allows for targeted interventions and resource allocation based on the specific needs of the population. The Dominican Republic's experience demonstrates that even with limited resources, significant progress can be made in addressing the growing burden of non-communicable diseases. By investing in prevention, early detection, and accessible care, countries can mitigate the impact of these diseases and improve overall population health. Section 6. The power of political will. Leadership for health. Across the globe, a common thread in successful health interventions is the presence of strong political will and leadership. This commitment, often emanating from the highest levels of government, is not merely rhetorical. It translates into tangible actions that prioritize health as a national imperative. Political will manifests in several ways. Firstly, it ensures sustained and adequate funding for health initiatives. By allocating sufficient resources, governments demonstrate a commitment to translating words into action. This funding supports crucial infrastructure development, workforce training, and program implementation. Secondly, strong political will drives the creation and implementation of supportive policies and legislation. Whether it's enacting laws to regulate tobacco use, mandating vaccinations, or promoting workplace safety, these measures create an environment conducive to better health outcomes. Finally, effective political leadership provides a clear vision for health, setting ambitious yet achievable goals and inspiring stakeholders across sectors to work together towards a common purpose. This vision acts as a guiding star, aligning efforts and ensuring everyone is moving in the same direction. However, political will is not a static force. It requires constant nurturing and vigilance. Building consensus, engaging with stakeholders, and demonstrating the tangible benefits of health investments are crucial for maintaining momentum and ensuring long-term commitment. Section 7. Communities at the heart, engaging local voices for change. Sustainable improvements in health outcomes are not achieved in isolation. They require the active participation and ownership of the communities they intend to serve. Recognizing that one size does not fit all, successful health programs are deeply rooted in the social fabric of the communities they reach, valuing local knowledge, cultural contexts, and traditional practices. Community engagement is not merely a box to be ticked. It's a fundamental shift in how we approach health interventions. It means moving away from top-down approaches and embracing a more collaborative and participatory model. This involves actively listening to community needs and priorities, building trust through transparency and accountability, and empowering communities to become active agents of change. One of the most effective ways to engage communities is through community health workers. These individuals, often from the communities they serve, act as bridges between healthcare systems and the people they aim to reach. They are trusted sources of information, provide culturally sensitive care, and help navigate linguistic and cultural barriers. Moreover, community engagement ensures that interventions are tailored to the specific needs and context of each community. What works in a bustling urban center may not be effective in a remote rural village. By involving communities in the design, implementation, and evaluation of health programs, we can ensure that interventions are culturally appropriate, acceptable, and sustainable over the long term. Section 8. Data-driven decisions, measuring impact and ensuring accountability. In the pursuit of better health, data is not just information. It's a powerful tool that allows us to measure progress, identify challenges, and make informed decisions. Robust health information systems are the bedrock of effective health interventions, providing the evidence needed to allocate resources wisely, track the impact of programs, and ensure accountability. Imagine trying to navigate a complex maze in the dark. Data acts as a light, illuminating the path forward and helping us understand where we are, where we need to go, and the most efficient route to get there. It allows us to move beyond assumptions and anecdotes and base our decisions on concrete evidence. Effective data-driven decision-making involves several interconnected steps. Firstly, it requires the establishment of comprehensive health information systems capable of collecting accurate and reliable data on a range of health indicators. This data should encompass not just mortality and morbidity rates, but also information on health determinants, access to healthcare, and the quality of services provided. Once collected, this data needs to be analyzed and interpreted to extract meaningful insights. This is where skilled data analysts and epidemiologists play a crucial role, using statistical methods to identify trends, patterns, and areas of concern. This analysis should be presented in a clear and accessible format, allowing policymakers and program managers to easily grasp the key takeaways. Finally, data should not just sit on a shelf. It needs to be translated into action. This means using the insights gleaned from data analysis to inform policy decisions, design targeted interventions, and allocate resources effectively. By closing the loop between data collection, analysis, and action, we can ensure that health programs are evidence-based, responsive to changing needs, and accountable for results. Section 9. A Global Health Future, Adapting Success for a Healthier World. As we stand at the crossroads of global health, the successes achieved by countries like Senegal, Liberia, and the Dominican Republic offer a beacon of hope and inspiration. These examples demonstrate that significant progress in health is attainable, even in the face of formidable challenges. However, the journey towards a healthier world is not about replicating models, but adapting principles. Each country's context is unique, shaped by its history, culture, resources, and political landscape. The key lies in understanding the underlying principles that drive success and tailoring them to fit the specific circumstances of each nation. As we move forward, several key priorities emerge. Firstly, we must strengthen global health partnerships, fostering collaboration and knowledge sharing across borders. The challenges we face are interconnected, and no nation can overcome them alone. Secondly, we need to invest in sustainable financing for health, ensuring that all countries have the resources they need to build resilient health systems and provide quality care to their citizens. This requires a shared commitment from governments, international organizations, and the private sector. Finally, we must embrace innovation and technology as powerful tools for accelerating progress in global health. From telemedicine to mobile health applications, technology has the potential to revolutionize how we deliver healthcare, particularly in remote and underserved areas. The pursuit of a healthier world is a collective responsibility, one that demands collaboration, innovation, and unwavering commitment. By learning from successes, adapting strategies, and working together, we can create a future where health is not a privilege, but a fundamental right enjoyed by all.